Chair. The honourable member for Edmonton Meadowlark.
Thank you, Mr. Speaker. On the 18th of November, the Government of Alberta and the Alberta Medical Association signed a historic new agreement that I consider to be good for physicians, taxpayers, and most importantly, good for Albertan families. Can the Minister of Health elaborate on the benefits Alberta families will see from the new amended agreement?
Deputy Premier.
Thank you very much, Mr. Speaker, and to the member for this important question. The agreement that was in place certainly was seeing increases at a rate that were unsustainable, Mr. Speaker. 6 to 8% increases in that one line item every single year. The agreement was negotiated by the third party. We, as soon as we took government, asked the AMA to come back to the table because we knew that wasn't sustainable. We want to have a strong public health care system for decades to come, and both recognized their responsibilities, and we were able to come up with a really strong agreement that's going to provide a significant benefit to Albertans, both in terms of savings and access, Mr. Speaker.
Supplemental.
Thank you, Mr. Speaker, and again to the same minister. For patients and families living in rural and remote communities, how will this new agreement help them?
Deputy Premier.
Thank you very much, Mr. Speaker. I was very pleased at the signing of the agreement to be joined by the President of the AAMDC, who we know for the first time Alberta will have in process a plan to actually manage where doctors go, where they're most needed, and the specific skill sets that are required for those communities. So many of those could be rural or remote communities, which we've heard from, or could be specializations within urban centres as well. I know one of the members opposite talked about how sometimes it feels like a whole gaggle of kids chasing after one ball to secure a doctor to come to their community. That's not fair, Mr. Speaker. We're going to make sure we're working in partnership with the communities and with the AMA.
Thank you. Second supplemental.
Thank you again, Mr. Speaker. Given that budget for physician services is a large component of Alberta healthcare costs, how will this new agreement reduce the rate of growth in healthcare spending?
Minister of Health.
Thank you very much, Mr. Speaker. We did, as I mentioned in the first response, see historic increases of 6 to 8%. This deal, we know, will save us in the range of up to $500 million over the next 2 years. That's significant investment that will be returned to the citizens of Alberta. And I have to say how proud I am of the fact that we had a very difficult situation. We sat down with the impacted parties and we found a better way to move forward, Mr. Speaker, saving money for taxpayers, as well as ensuring that we have stable access and actually an improved system in areas where it's certainly needed. So this is going to help us enable the right care in the right place, the right investment.
Thank you, Honourable Minister.